Hello, hello, hello. This
Good
is
morning.
another episode of Black Parents Aging. This is Olivia Smith, and I have a very special guest that I am excited to speak to, Dr. Kathryn McFarland. And I know her because she came to me as a client, but she is also a cardiovascular doctor, a cardiologist. And so I'm going to talk to her all things heart related. But I am going to give her the floor and kind of let her introduce herself the way she would like for you to know her. And welcome to the show.
Thank you so much, Miss Olivia, for having me on the show today. It's an honor and a pleasure. Um, I'm pretty basic, so
Same.
I'm a, I'm I'm a cardiologist. I'm from Minnesota. I love taking care of patients, and I believe that patients deserve more than a 10-minute interaction. I believe that patients deserve to have their questions answered. I believe that family needs to be a part of the interaction so everyone understands what's going on. And I believe in treating my patients like they're my mom. And if I treat a patient like their mom, I know that they're going to get good care. I know that I've done the best that I can do, and I'm doing what is called for me to do.
Yes,
So
I love
that's
that.
kind of my philosophy. I've been in practice for over 20 years, and I do invasive cardiology, but I really care about prevention and moving um, patients and communities towards health instead of illness.
Love
So
it.
that's kind of where I'm at.
I love all the things that you said. So if we were to go back a little before we get into it, what brought you to the world of cardiology? Because I can imagine that was not an easy path. Is that something you always wanted to do, or is there something that happened that kind of led you there?
Sure. So I had every intention on being an endocrinologist and doing research and studying diabetes. But when I was in training, a colleague had a medical emergency with their family member. And so I got the privilege of doing not 1 month in a row, but 2 months in a row of cardiology. And what really made the decision for me was seeing that at the time of a heart attack, that is a critical moment of time, not only to open up a blood vessel, but to change a mindset.
Mm.
And so I wanted to be able to impact patients and really capture their attention at the moment where they can make change. And that is what really solidified my decision because no one wants to have a heart attack, but after you have a heart attack, there's some pretty significant changes that can be made and that patients can benefit from if they do make changes. So I just wanted to have the most impact that I could on patients' health.
I love that. And so currently your practice is Kingdom Cardiovascular Care and Wellness Center, and that's here in Douglasville, right?
Yes, ma'am. 8687 Hospital Drive. I am right across the street from the courthouse.
Love that. Okay. So tell me how your practice is different, if it is different, and what led you to start your own practice.
Sure. So it was really a call on my life to do that, but I was scared.
Mm-hmm.
And I did it 2 years after I was supposed to do it. But I had been getting frustrated with the current healthcare system where they want you to see 40 people a day. They want you to code at the highest amount that you can code for. They don't give you time to do your charting. And so the patient is really not getting what they need. And then patients have questions.
Sure.
And if you can't get them to understand the why, you cannot buy into a doctor patient relationship and get them to sign on to healthcare changes. And so it really was born out of that frustration and a need to increase access to people of color, and not just have these big machines. And if you don't have the right insurances, then you can't be seen, but really trying to focus on the patient and educating them
Yes.
so that they know why they're taking this medicine, what is the reason for it, how does it work, how is exercise going to improve my situation, those types of answers. And we really focus on them understanding, and we don't stop until they do.
I love it. And we connect on that education piece because that is such an important piece for our community. So I was looking up stats, and one of the stats that I saw said in 2019, African Americans were 30% more likely to die from heart disease than their white counterparts. Why
Yes.
is that?
That is for several different reasons, but
Okay.
most importantly, access to care, knowing when you should enter the healthcare system for emergencies. And then there's lots of healthcare disparities that prohibit people from coming and getting treated. And so we've got to be able to address all of these issues. But a lot of times, people of color are misinformed and they don't have
Yeah,
the right information, and they think, oh, it'll get better, oh, it'll stop, I'll go tomorrow. And then some don't wake up. Um,
absolutely.
yeah,
Okay, so let's start from the beginning. So this podcast is for children, grandchildren, loved ones of aging parents and other loved ones to try to help us be a second set of eyes and ears for our aging loved ones. So let's talk prevention because that is helpful to us as well. What are the things that we need to be doing to have a healthy heart, to maintain and keep a healthy heart, and to prevent cardiovascular disease and heart attacks?
sure. So the first thing is a heart healthy lifestyle. So that includes exercise. We even encourage exercise for our patients that have got heart failure. So really walking 20 to 30 minutes a day is going to do so much for your health. Walking will decrease blood pressure, it will decrease cholesterol, it'll decrease blood sugar level, and then it helps with your mood, it helps with digestion, it helps your outlook. So exercise is a huge part of that. And it doesn't necessarily have to be walking. It can be riding a stationary bike. It could be swimming and water aerobics. It could be tennis, whatever you like to do, walking your dog. Um,
Mm-hmm.
there's many different forms of exercise that will help to achieve better health. So that's one thing.
Okay.
Another thing is a heart healthy diet, and I hate
Mhm.
the word diet, but the
I'm sure lots of
Mediterranean.
people have hate that word as well. Yes.
Yes, but the Mediterranean diet is really a lifestyle change. So
Okay.
eating lean cuts of meat, not that ribeye that everybody, is trying to get, but lean cuts of meat, fish, poultry, chicken, um, shrimp, seafood, that kind of thing, whole grain breads, Greek yogurt, honey, lots of fruit, lots of vegetables. That is what's important. Olive oil instead of other forms of oil that are not good for you. So that is really a very good um, diet that people can live on,
Sure.
and have it extend for not just 6 weeks or
Right.
whatever, but for a lifetime. And then a big thing for the African American community is really limiting salt.
Mm-hmm.
There's so many forms of hidden salt, you know, soda, canned soda, um, potted meat, spam, um, canned sardines, um, ramen noodle bowls, you know, high sodium foods are really not healthy. They lead to swelling and elevated blood sugar or blood pressure. And so we really need to make sure that people know how to read labels when they go to the
Yes.
grocery store. And sometimes you think, oh, if you see what the salt is, you think, okay, well, this is good. But if it's 5 servings and it's 1,000 milligrams, you've gotten, 5 times the amount of sodium that you should have
Right.
in a day. And so people really need to educate themselves on how to go to the grocery store and how to shop heart healthy.
I love that. So it's exercise, it's what you eat, and it's also really paying attention to sodium intake.
Yes, and portion control, because sometimes that is a problem for
That,
us. We
yes.
we want to eat and have sideboards attached to our plate, right? And so we really have to, be concerned about the
Yes.
the portion size.
No, that is absolutely that's a big one because you think you're eating
Hmm.
healthy, but if you eat too much of anything, that's still not healthy.
Yes, yes.
Pause.
Okay.
So that's for preventative purposes. What about for us when we are visiting with our loved ones, when we are, spending time with them? What are the things that we should be paying attention for, the symptoms that may say, okay, we need to make a doctor's appointment or something may be going on here?
Sure. So I'm going to answer your question, but I'm going to also just add a little something. So when we're together with our families and we're trying to have a good time, a couple of things that we need to break out of the mold of. A lot of
Okay.
times we're very secretive as people of color. And when you go to the doctor, we typically ask about family history. And
Yes.
we don't just go back one generation. We try to go back 3 generations. And sometimes families are so secretive and they don't want to let people know, what they're dealing with and what they have. But really, we need to know because there are things that run in families. And
Yes.
if we know that there is a history of diabetes, then we can be looking for that in you and we can guide you on how to prevent diabetes from happening. But if we don't know that, your mother, your grandmother, and your great grandmother all had diabetes or all had renal failure and are on dialysis, it's very hard for us to know that. So we need to be able to incorporate into our traditions a time where we let each other know what are we dealing with.
So that is such an important point because I know even when I go to the doctor and I get that history, I go by, okay, what do I know? And if I don't know, then I skip right on I don't call and ask my mom or I skip on past it into the next thing. And we probably don't take it as seriously and spend as much time answering those questions, or if we don't know them off the top of our head, calling and seeing if someone else knows them so we can fully fill it in as we need to. I know that I am definitely guilty of that. And so that is a great point.
Yes. And a lot of times, just like you said, I give the patients the time. Look, by the next time you come, this is your
Mhm.
homework. You need to ask and find out, what you have. It's okay. And even if there's a family member on the phone during our patient interaction, I will stop and turn the attention to the phone and ask them because they may know different parts of the history that the
Right.
patient themselves don't know, but it is very important.
No, that is great advice and something we all need to do a better job of. Just collecting that from older family members too, because and
Yes.
this transcends over to what we do in estate planning. Like don't let everyone pass away and you not have gotten that information that you need. And so definitely medical history is another one that let's ask the people that might know while they're here so we can write it down and have that information.
Yes, yes. The other thing, while we're kind of on the same point, is, social history. We need to know, you know, do you drink? Do you smoke? Are there things that you're doing that might not be really helpful to your heart health? But that is part of the history as well. And then sometimes we're all different. Alcohol can be a toxin. So you may have, a family member that has had an enlarged heart, and there's two other cousins that have enlarged hearts, and it could be related to a family genetic thing, or it could be, family behaviors. And so that's really important. The other thing you asked me was about symptoms, and I would like to just say a couple of things. Number one, classic symptoms can happen to anyone.
Okay.
Okay. Classic symptoms are pain in the center of the chest. That pain may radiate to the shoulder, down into the armpit, down into the left arm, into the neck or the jaw, or even into the back. Some people may break out into a cold sweat. They may feel short of breath. They may feel like they're going to faint or pass out. And they might even have nausea or vomiting. Those tend to be very classic symptoms. Women can have classic symptoms, but then women can also have unique symptoms. They may feel profoundly fatigued, especially if they're doing something.
Mm-hmm.
I just don't have the energy. I don't have to get up and go. Every time I come in from the grocery store and bring the groceries in, I'm just exhausted. Or I can't put a finger on it, but something's not right. And we always encourage women to, if they know their bodies and they know something isn't right, to keep on pressing. Talk to your primary care doctor. If your primary care doctor blows it off, find someone else because they can have very unique symptoms.
Got you. And so if you are experiencing any of these symptoms, you need to talk to your doctor.
Absolutely.
Do not, and we do put off things and we think that it's going to
Hmm.
go away and we think, oh, it's probably nothing. And
Yeah,
so make sure that if you're talking, and if you're talking to your aging parent or aging grandparent and they're complaining about these things, go ahead and help them make an appointment or make an appointment for them. So
absolutely.
at the beginning of our interview, you talked about the moment of impact being having a heart attack and then what happens after that. And so for our listeners who themselves have had a heart attack or who've had family members who've had a heart attack, what is that new reality and new normal, and what are the things that they should be doing and paying attention to after that?
Great question. So there's several things that's happening all at one time. It's a wake-up call. You thought you were fine until you had these pains. You came in, you got evaluated, you found that you had blockages, either having the need for a stent, which is a small tube that goes into the blood vessel to keep it open, or worse, finding out that you need bypass surgery. So patients can experience depression because it's a new change. So that's something that needs to be watched out for. Then usually after a stent is put in after a heart attack or after bypass surgery, it's very important for people to attend cardiac rehab. Cardiac rehab helps to decrease the chance of passing away and improves the quality of life. And in cardiac rehab, They're monitored as they learn the appropriate level of exercise for them. During cardiac rehab, they also get many lectures on diabetes, high cholesterol, high blood pressure, heart failure, stress, so that they're better equipped to make these longer lasting changes for their health. And so it really is this process about, okay, now you've got a new blood flow to your heart. Now let's really make sure that we keep everything on the right path, because we don't want more stents. We don't want, to have bypass grafts blocked off and need other intervention. And so it's really about changing the things that we can change. There's a lot of risk factors that we can change. We can change our blood pressure. We can change diabetes. We can change high cholesterol. We can even change smoking. But what we cannot change is that family history of heart disease.
So I wanted to circle back around because not with heart disease, but with my cholesterol level, I'm experiencing this. I think I eat pretty well. And I've had a couple different tests and it's always a little elevated. And I don't want anything to ever be elevated. And so my dad is just like, mine's elevated, like that it runs in the family, like your grand. So I feel like sometimes we have the feeling like, it's hereditary. What do you want me to do? How are we supposed to handle, and what are the things we're supposed to do when a disease, cardiovascular disease, does run in our family? And there's nothing that we're doing. We're trying to do all the right things, but we're still having issues.
So I too am in that same category. Both of my parents had high cholesterol, and I have high cholesterol as well. And it used to bother me. My brother, he loves to cook, and he makes all these cream sauces and all these really rich foods, and he didn't have problems with cholesterol.
Yes.
So when we find that out, usually the first step is, okay, let's make lifestyle changes. Definitely a low cholesterol diet, making sure that we're exercising, because we know exercise will lower blood cholesterol levels. And then if we're still doing all of the right things, but it's still elevated and we have the increased risk because there's coronary artery disease in our family, then that person may need the blood pressure or the blood cholesterol medicine that will help to decrease the amount of cholesterol that's produced in the liver and lower the risk that way.
So we are almost done. But I think, we really focus on the African American community. And so if there was one takeaway that you would want a listener to have out of, you've given many golden nuggets, but if there was one overall thing that you want to make sure that you drive home, what would that be?
So in the 3 years before COVID happened, those were the three highest years that African Americans and people of color were either uninsured, underinsured, or had an insurance benefit but never used it. COVID came along. It had a predilection towards people with pre-existing, conditions, and our communities and families were decimated.
Yes.
And so people need to visit their physician, not because physicians are trying to extract money from them, but we care about prevention. We want to know, do you have any diseases? Is there stuff that we can help you to control? Because we want you to be healthy, and we don't need to get caught off guard how we got caught off guard before COVID happened.
Absolutely.
And so if you have insurance, then make sure you use your benefit. You're paying for it. So use the benefit and find out what needs to be tweaked with the healthcare that you have.
No, that is absolutely true. I think there is an inherent mistrust, rightfully so, sometimes,
Mhm.
of
Mhm.
systems in our
Yes,
community, and to our detriment. And so find a doctor that you trust,
yes,
one that takes time for you, one that, answers your question, one where you don't feel rushed, but find one. Don't use that as an excuse to just say, I'm not fooling with these doctors. I'm not going, don't do that.
yes,
Especially if you have insurance.
yes.
No, that is great, great advice. We're going to get out of here, but I know you wanted to talk about an event that you have coming up. So tell us about the event. Tell us about where, if people are looking for a doctor, how they can find you, and then we're gonna get on out of here.
Okay. And thank you for the opportunity to let your listeners know. February is Heart Awareness Month, and every year we do a heart healthy luncheon and fashion show. And it's since the first year of my practice opening, it's called the inaugural Red Awards. Award stands for Alerting Women About the Risk of Diseases. We have a heart healthy luncheon. We have a physician speaker and usually a patient testimonial, in addition to a red dress fashion show. Everybody wears red. There's lots of free giveaways, and it's just a fun atmosphere to learn about the spectrum of cardiovascular disease. And every year it's different. This year it will be at the Douglasville Convention Center Ballroom, February 10th from 11 to 1:30. I will send you a link and all the information. We have a QR code if anyone wants to come to the luncheon. It's a great time and it really speaks about awareness. Do I have one more minute?
Go ahead. Absolutely.
So I just want to be able to thank you personally because when I met you, you really helped to clarify things for my family. I had a mother with dementia, and we were trying to figure out the will and the trust. And my father, who just turned 90, we were trying to get all of his paperwork in order. And there were things that I just didn't understand. I didn't know how to navigate. And when you came into our lives, you made it smooth. You made the path clear. We understood it and we were able to benefit from everything that you taught us and you helped us. And I'm just I'm just grateful for that. And I think that everybody needs to know the services that you and your partner provide are just so important for elder care.
You're going to make me cry on the podcast. That will be a first. Thank you so much. In the same way that you say when you're talking to clients, you picture talking to your mom. I think my law partner and I picture that for our grandparents. And so we want
Yes,
to help as many families and serve as many clients as possible. So thank you for saying that. That really does mean a
it's
lot.
true. It's
Thank you.
true. I appreciate you.
So I am going to have Dr. McFarland's information. So if anyone wants to reach out, I will have that in the bio, and we will send out in our newsletter information about the Red Awards in February. Thank you so much for taking time out of your day to speak with us. And I know for sure our listeners are going to benefit from the information that you provided.
Thank you. Blessings to you and your partner in 2024.
Same to you.